Hi and welcome back to another video of Medic Notes. This video will be on prolapsed intervertebral disc. Prolapsed intervertebral disc is when there is an acute posterior or posterolateral herniation of the nucleus pulposus through the annulus fibrosus in the vertebral body. So you can look at this picture. The central part is the nucleus pulposus, whereas the outer part is the annulus fibrosus. So when there is prolapse disc, there will be herniation as shown in the picture. And then the nucleus pulposus that herniates out will compress on the neural structures, causing the symptoms. So the severity and extent of the herniation depends, and it can be called as sequestration, protrusion, extrusion, or bulge. So the first, you can look at the picture there. This protrusion is when the nucleus pulposus will herniate through a large tear, whereas extrusion is similar, but nucleus pulposus will herniate through a small tear. And for sequestration, there is separation of the herniated segment from the rest of the nucleus pulposus, as shown in the picture. So the background of prolapsed intervertebral disc, it is commonly occurring in people among 25 to 40 years old, and usually the cause is due to a precipitating event of local straining or injury, where they might have done activities such as weightlifting or stooping. So we have to take a history on what they were doing at that time when they felt the pain. And the common levels affected are the cervical level, either above or below the C6 vertebrae, and another common site is at the lumbar area, between the L4 and L5, and between L5 and S1. So the symptoms that the patient might complain of are lower back pain. Sciatic pain is the pain associated with the lower back pain, which will radiate down to the legs and depends on the nerve root that is compressed. The pain may even radiate to the calf muscles, heels, the front of leg, and also ankle. So other symptoms include neurological symptoms, where they may complain of pins and needles sensation in the area supplied by the affected nerve root. There may also be numbness or muscle weakness of the leg or foot. And there is a more serious form of the neurological disease, where there is bowel and bladder dysfunction due to compression of the lower nerves within the spinal cord. And this condition is also known as cauda equina syndrome, which is a surgical emergency. So the signs that we can look for are listing paravertebral muscle spasm. They might have protective scoliosis and also loss of lumbar lordosis. So on palpation, feel for midline tenderness. And for move, the pain will be worse on flexion or straining activities like coughing or laughing, and also expect a reduce in range of movement. And one of the physical examination finding would be straight leg raising test, where the patient is asked to raise the leg straight while lying down. If there is pain at 40 degrees or less, the test will be considered positive, and it is suggestive of nerve root compression. So for investigations, can do X-ray for AP view, lateral view, and oblique view. This is to look for decreased joint space, which is expected in prolapsed intervertebral disc. Shown in the first picture, there is narrowed space between one of the common sites, which is between L5 and S1 vertebrae, suggesting that there may be a prolapsed intervertebral disc. And X-ray can also be done to exclude any bone disease or other differential diagnosis. MRI is another investigation for surgical planning and also to rule out cauda equina syndrome. So if you look at the second picture, it shows an MRI. It can also show that there is a disc prolapse compressing on the spinal cord. For management of prolapsed intervertebral disc can be divided into conservative and surgical management. So conservative management consists mainly of rest and reduce, where by giving conservative management, the symptoms in 75% of the patients usually resolve. So rest, which means continuous bed rest, prevent unguarded movement, physiotherapy, and also analgesia like NSAIDs, or can also consider epidural steroid plus local anesthetic injection. Reduce, by doing traction, can reduce the herniation. So continuous bed rest and traction for around 2 weeks decreases the herniation in more than 90% of the cases. So you can see how effective the conservative management is. Whereas for surgical management, includes remove and rehab. And some of the indications for surgery would be cardiac equina syndrome, which I mentioned is a surgical emergency, or there is failure or conservative treatment after 3 months, where there is persistent pain and neurological deterioration with frequently recurring attacks, then we can consider surgery. So the procedure would be fenestration and discectomy or microdiscectomy. And whereas for rehabilitation, post-op, we advise them for light work after 1 month and heavy work after only 3 months after the surgery. So that's all for this video. Thank you.